Hello, myself Dr. Bhushan Nagarkar. I'm the consultant and head of the intensive care unit, that is ICU, in Manipal Hospital Baner, Pune. Today in this video, I'm going to talk about dengue fever. Rainy seasons are coming and tropical infections like dengue fever are prevalent during this season. Now, dengue fever is caused by flavivirus and it is transmitted from person to person by mosquito bite, which is the Aedes mosquito. Dengue fever is broadly of three different types. One is classic dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Most of the patients will have the classic dengue fever, which is also called as plague-borne fever. In this, the patient will have high-grade fever, severe body ache, including headache, joint pain, muscle pain, nausea, and vomiting. Some of the patients with classic dengue fever can develop dengue hemorrhagic fever, which is a severe form. In this, the patient will have high-grade fever, low platelet count, bleeding tendencies, bleeding from skin, oral cavity, anywhere in the body. And there will be leaky blood vessels causing severe swelling and edema all over the body. The third one is dengue shock syndrome, in which this is the another form of the severe dengue shock syndrome, in which the patients will have features of dengue hemorrhagic fever. Along with that, will have features of shock, that is low blood pressure and very weak pulse. Talking about the treatment of dengue fever, very important is control of fever, control of pain. Bear in mind, avoid aspirin and NSAIDs, which can cause bleeding. Plenty of fluids and hydration is very important. Plenty of rest and avoid exhaustion. Some of the patients who cannot take oral fluids will need IV drip. Now, patients with dengue hemorrhagic fever and dengue shock syndrome will need admission to intensive care unit. They need a close monitoring, close watch onto the platelet counts, and need judicious IV drip and fluid management. These patients will need frequent reassessment of vital signs, which is very crucial. If the patients with dengue hemorrhagic fever and dengue shock syndrome don't get prompt and correct treatment, they can land up into severe complications and can also cause death. I hope you've got a clear idea about dengue from this video. Thank you.